My name's Amanda Feilding.
My name is David Nutt.
My name is Dr. Stephen Ross.
I'm Rick Doblin.
I'm a psychiatrist.
I work at the NYU School of Medicine at Bellevue Hospital.
A psychopharmacologist.
I direct the Division of Alcoholism and Drug Abuse in the Department of Psychiatry at Bellevue.
They call me Professor of Neuropsychopharmacology, which means I study drugs in the brain.
In addition, I am the director of the NYU Psychedelic Research Laboratory.
I realized it was essential to change and reform global drug policy in order to be able to study. So I became a foundation and I got the leading scientists in the field.
I founded and direct the Multidisciplinary Association for Psychedelic Studies, essentially a nonprofit pharmaceutical company focused on psychedelics and marijuana. And our top project is making MDMA-assisted psychotherapy into an FDA and European Medicines Agency approved treatment for post-traumatic stress disorder.
Maybe these substances can actually help heal this mounting problem we have of mental health, which is increasing. Only through the best scientific research will we undo the damage which has been done for 50 years of media bad-mouthing of these substances.
I'm working with the Beckley Foundation. We started doing some studies, and the results of those studies were tantalizing, they were powerful. They suggested not only an underpinning basis to the effects of these drugs in the brain, but also they suggested they might have therapeutic potential as a result of the changes we saw.
I knew from a very early time, before MDMA was even criminalized, that it had incredible potential for post-traumatic stress disorder. We began in 2000 to try to do work with PTSD. And since then, we've done research with PTSD patients in Israel, Switzerland, Canada, and the United States.
The studies have been up to the top standards. So now we need to expand the studies and hopefully move towards phase 3 studies, where finally these substances, these compounds, become legitimate licensed medications.
The problem with funding for psychedelic research is it's incredibly hard to do. The federal government will give approval through the FDA and the DEA, but the NIH agencies don't appear yet ready to fund psychedelic research.
What we're trying to do is probably the most difficult area of health research. We're working in a field of mental health which is stigmatized and underfunded compared with other forms of health research. And we're working with illegal drugs. Not only is it very difficult to raise money, but also we have to raise rather a lot of money because the constraints of working with illegal drugs means that the expenses go up enormously.
You can't do research without the sufficient funds. So now that we have a core group of individuals, we need resources to keep going, and then we have these hundreds of projects. So if we had more funding, we could accelerate the rate of the research, we could accelerate potential discoveries and breakthroughs, and we could accelerate the rate at which these medicines may become available to alleviate human suffering.
Now we've got the turning point in the scientific research. So suddenly people are getting excited.
To be able to be part of something that could radically change how care is delivered, no matter what the amount of money is, it gives people the ability to directly participate in something that's related to their own health.
You will agree, I think, that the research we're doing is fundamental, and it would be wonderful if you could fund Fundamental, the crowdsourcing group, to support our research.
Fundamental is an entity that has stepped in to help us fund psychedelic research where other entities are unable or unwilling.
I think it would be wonderful if the public would get involved in this campaign being run by Fundamental to try to heal the human sickness in all sorts of varieties.
What we want to do is make psychedelics into medicines and, in the end, improve the mental health of the public in such a way that we can deal with the crises that we're facing in many different areas. And your donations to Fundamental will help make that possible.
It's an exciting process to be involved in, and thank you, Fundamental, for doing this work.